Today our topic is intestinal obstruction. So today we discuss about intestinal obstruction disease, its definition, causes, sign and symptoms, diagnostic tests, lab tests, complications, treatment and diet. So first of all we study definition, means blockage and loss of small and large intestinal movement leading to distension of abdomen. Causes: hard feces, tumor, foreign body, chronic constipation, gallstone, strangulated hernia, hematoma, Crohn disease, mean inflammation of intestine, fecal impaction, hard feces on intestine. Signs and symptoms: severe abdominal pain, abdominal rigidity, chronic constipation, absence of flatus, loss of peristal intestinal movement, abdominal distension, nausea and vomiting, absence of stool. These are the signs and symptoms of the intestinal obstruction. Diagnostic tests: radiological test, sigmoidoscopy, ultrasound of abdomen, plain X-ray abdomen, CT scan and MRI of abdomen. Lab test: blood for CBC, blood for urea, creatinine, electrolyte, liver function test, PT, APTT tests, viral markers. Complications: peritonitis, gangrene, retention of urine, rupture of intestine, and also death. Treatment: medication therapy. We can provide drip therapy, antibiotics, vitamin B complex and vitamin C, purgative clean enema, surgical therapy, laparotomy, opening of the abdomen, ileostomy, opening of the ileum, colostomy, opening of the colon, health education and diet. And nothing per orally NPO till improving condition. NG tube should be passed for aspiration purpose. Flatus tube should be passed for excretion of gases.